Today's RSA University educational opportunity is about Medicare basics and what to think about when you're turning 65. Let's learn more.
Let's get started. There are three ways to become eligible for Medicare. The first that most are familiar with is turning age 65. If you turn age 65 in August, for example, you become eligible on the 1st of August. So if you enroll a little bit later in the month, even if it's August 19th, it also automatically goes back to that 1st of August for your enrollment. You're also eligible for Medicare if you are receiving Social Security disability benefits for 24 months. You're also automatically enrolled in Medicare Part A when you turn 65 and or disabled, and if you're collecting Social Security. Remember that you can start collecting Social Security starting at age 62, but remember that when you turn 65, that's when the Medicare becomes eligible and your Part A enrollment would automatically take effect at that point. If you're still working, you can waive Part A without penalty if you're covered through an employer. You can also waive Part A and Part B if you're delaying Social Security beyond that age 65 date. Some of the key terms and definitions that you should be aware of when we're talking about Medicare. The first is original Medicare, or what some people simply call Medicare. That is Parts A and B coverage. That coverage is provided through the federal government, not through any specific insurance company. Part A is for the larger expenses, things like in and outpatient hospitalization, skilled nursing, rehab, hospice, etc. For most people, there's no premium cost for Part A. This comes as part of your taxes that you've paid through your working career. Part B is for the more day-to-day expenses and is optional. That pays for things like office visits, lab work, durable medical equipment, preventive expenses, some outpatient surgeries, etc. And there's a monthly premium cost for that. For most of us, that is about $165 a month. It goes up as your adjusted gross income goes up if you're a high wage earner, but you should, most of us should be in that $165 a month range. If you're enrolled in original Medicare, you also have the ability to enroll in Medicare supplement plans. Sometimes these are called plans F, G, or N, or Medigap plans. They have a couple of different names. These are optional to go alongside your original Medicare, and they're meant to fill in those gaps in coverage. You can only elect one supplemental plan to go with your original Medicare. Alternatively to original Medicare and Medicare supplement plans are Medicare Advantage plans, also sometimes known as Part C plans. These are offered by private insurers, groups like Blue Cross Blue Shield of Michigan or Priority Health, Humana, United Healthcare, etc. And these are meant to cover at least as much as the original Medicare Parts A and Part B do, oftentimes with additional coverages as well. And then lastly is Part D for prescription drug coverage. These are all through different private insurance companies. Some are part of Medicare Advantage plans, some are standalone prescription drug plans that you would pair with an original Medicare and or Medicare supplement plan and piecemeal all of those parts together. But sometimes if you're in a Medicare Advantage plan, they're bundled together for your convenience. One of the other things to consider if you are about to become eligible for Medicare is your health savings account. And I'm going to primarily focus here on those folks turning 65, not through a disability, just because you can plan a little bit more for the age 65. So when you turn 65, your contributions are impacted by that Medicare eligibility. And you'll notice down in the list there, you can continue to use your HSA expenses for expenses throughout the rest of your life. These restrictions that we're going to talk about are strictly around the contributions that you can make to your health savings account. If you are enrolling in Medicare when you turn age 65, you have to prorate your HSA contributions for that year. So if your birthday is in August, you have to prorate that by, you can contribute 7 months of the year prior to becoming Medicare eligible on August 1st. So very simply, you would take the maximum amount for the year. If you're single, for example, maximum for this year is $3,850, plus there's a $1,000 catch-up amount. Divide that amount by 12 months and multiply by the number of months that you're eligible for the year. 6 months in the scenario here, or in my example, 7 months if your birthday's in August. You can no longer contribute to your health savings account once you become enrolled in Medicare. So that's a really big distinction that everybody must be aware of for that. If you delay enrollment in Medicare, say you're still working full-time, you're enrolled in your company's benefits, and you decide to go on Medicare after you've turned 65, let's say you're age 70, you can still do so, that's fine. You can contribute to your health savings account as long as you have waived Part A coverage, you waive Part B coverage of Medicare, you can contribute to your health savings account, but you do have to stop those contributions 6 months prior to becoming Medicare eligible and enrolled. So you need to really plan ahead and know what that date is so that you don't over contribute to your health savings account and owe taxes on those amounts. So remember, we mentioned before, if you elect Social Security at age 62, when you turn 65, you're going to be automatically enrolled in that Medicare Part A. So you need to pay attention to that very closely. If you've got a tax advisor, now's the time to potentially talk with them as well. You're still actively working at age 65 and your benefits eligible, kind of like we talked about on the previous slide. You can still be covered by your employer's plan, whether you're an actively working employee or even a retiree, but which plan has priority, whether that's Medicare or your insurance carrier, varies on the size of the employer that you work for, or if you're retired or if you're disabled. So I'm not going to go through each of those different options there, different scenarios, but you can see those there and just pay attention to those as you get to that age and find yourself having potentially dual coverage and which one is primary. So a few more things to think about when you're approaching Medicare age in particular is just like a good story, the who, what, when, where, and how applies here. So who will be covered? Is this just yourself? Are you and your spouse the same age? Are you turning 65 at the same time? Is your spouse younger than you, older than you? That makes a big difference in terms of what coverage you'll need, whether you're both going on Medicare, you're both on Medicare Advantage plans. Spouse is younger and needs individual coverage. Can you use COBRA continuation from your previous employer to cover your spouse or yourself? All those things go into effect into who will be covered. What coverage will you need? Are you doing original Medicare? Are you utilizing Medicare supplements? Are you doing a Medicare Advantage plan instead? But choosing which coverage is most appropriate for you is a big step that you'll have to take. When will you retire? This is not just age 65, as we talked about on the previous slides. You may continue to work and you're age 70. Your spouse may be significantly older or younger than you. That may impact when you retire and when you go on Medicare. Where you will live will make a big difference. If we talk about Medicare Advantage plans in particular, there are typically narrower networks. Just like when you had employer coverage, sometimes you had to stay in the network in Michigan, for example. But if you plan to live in Arizona for 6 months of the year, you need to make sure that you have national coverage so that you can see providers and doctors down there. And then how much will my coverage cost? There's a huge array of different costs and options that are available to you, whether you're talking about original Medicare and different supplements, or whether you're looking at the Medicare Advantage plans. There's a huge variety of coverages. And of course, with those coverages come different costs as well. So make sure you're taking into account all those different factors when deciding what makes sense for you and or your spouse. A couple of resources for you. Medicare.gov, believe it or not, is actually a really great resource for a lot of the things we just talked about. I highly recommend that you talk with a Medicare expert. This should be at no cost to you at all. They get paid from the insurance companies if you're doing a Medicare supplement or Medicare Advantage plan. Rose Street Advisors does have a referral partner. Her name is Amanda. She's at the Shelling Agency. Her contact information is there. She can also help with individual coverage. So for example, if your spouse is younger than you, you go on Medicare, but you need individual coverage for your spouse, she can help find those different options for you. And then kind of a side note to this, all of this is tied into your financial plan for your retirement as well. If you don't have a financial advisor, you're welcome to contact our financial advisors at Rose Street Advisors. But if you have one already, feel free to use them, ask them the questions that you may need to factor in how much your Medicare Advantage plan is going to cost, or your Medicare supplement plan. How does that factor into the money you have to spend in retirement as well? But if you do need a financial advisor, you can utilize those contact factors there and reach out to us for any help. So with that, I just want to thank you for your time. If you have any additional questions about any of these Medicare basics or what happens when you turn 65, feel free to reach out to us. If you're already a client of Rose Street Advisors, you can talk to your relationship manager. If you don't know who to talk to, feel free to reach out to info@rosestreetadvisors.com or call us at 269-552-3200. Thanks for your time.